The Physician-Committed Program is an innovative approach to transforming the healthcare setting. While traditionally healthcare focuses primarily on physical health, the Physician-Committed Program encourages a comprehensive healthcare setting focusing on behavioral health as well. This project will standardize the process and protocol used for screening adolescents for mental health and substance use issues. This is accomplished by providing medical professionals training on the algorithms and screening questions that they can easily and efficiently incorporate into their medical screening processes and protocols. This initiative can detect risk early. It is empirically based, fast, versatile, and is the simplest way to integrate emotional and mental health into the primary care setting. Why screen for underage drinking? It often goes undetected. Many adolescents have annual doctor visits, and many are willing to confidentially discuss alcohol use. As a healthcare provider, you are in a position to identify drinking-related risks and intervene. Our hope is that the brevity, ease of use, and predictive strength of this new tool will enable you to detect alcohol risks and prevent harm at the earliest possible stage. It's common. Alcohol is by far the drug of choice among youth. Over the course of adolescence, the proportion of kids who drank in the previous year rises tenfold. It's risky. Short-term adolescent drinking often results in poor academic performance, unintentional injuries, aggression, victimization, infections, suicide, and death. It is also linked to unplanned pregnancies. Long-term, underage drinking is associated with increased risk for alcohol dependence. It's a marker for other unhealthy behaviors. When adolescents screen positive for one risky behavior, whether drinking, smoking, tobacco, using illicit drugs, or having unprotected sex, it's generally a good marker for the others. For many youth, drinking alcohol is the first risky behavior tried. Why use this tool? This early detection tool aims to help you prevent alcohol-related problems. It uses 2 alcohol screening questions and 3 mental health questions that can identify risky alcohol behavior before it starts or address it at an early stage. These are powerful predictors of current and future negative consequences of alcohol use. It's also the first tool to include a question about friends drinking. How to use this tool. Step 1, ask the screening questions. The questions can vary with the age of the patient that you're working with. For kids ages 9 to 11, you want to first ask if their friends have ever drank alcohol. Then, you want to ask them if they've ever had alcohol. Here's an example of how simple and fast the conversation can be. For middle schoolers, start with the friend question. Then follow up with another question about their relationship with alcohol. For high schoolers, ask them a personal drinking question first, then ask them one about their friends. Step 2, assess the risk or guide the patient. If your patient does not drink, then you will use this guide on patient dialogue. What's most important during this portion of your dialogue is that you praise your patient for their decision not to drink. When praising them, make sure to mention the mental and physical health benefits of choosing not to drink. Also, make sure to explore how your patient plans to stay alcohol-free, especially if they're feeling the pressure from their drinking friends. Remind them that a simple "no thanks" or "I don't want to" is the easiest response when offered a drink. Now, if your patient does drink, then you will utilize our Assess Risk chart and dialogue. This chart provides estimates for young people's drinking risks. When looking at the chart, be sure to factor in your patient's age and how frequently they drink. For example, a 15-year-old who reports drinking about twice a month or 24 days in the past year is at the highest risk for adverse consequences. Remember to factor in friends, psychosocial development, level of family support, drinking and smoking habits of parents and siblings, and trouble with authority figures. Step 3, advise and assist. If your patients drink, this is the next step. Here are some different talking points that are categorized by risk level. You will offer advice, troubleshoot the issues, inspire them to commit to change, or collaborate with them on a personal goal. Finally, you will schedule a follow-up if needed. Step 4, follow-up, continue support. It may be uncommon for your patients to return for an alcohol-specific follow-up, but when your patients return for any reason, you'll have the opportunity to follow up with the goals you set earlier. You will use this chart as your guide in following up with your patient. If they met their goals, you should reinforce these goals and support them for their strengths and health decisions. You also can create new goals. If they were not able to meet their goals, then you will reassess their risk. Acknowledge that change is difficult and identify the specific challenges they had in meeting their goals. Regardless of whether your patient upheld their goals, you will conduct, complete, or update the comprehensive psychosocial interview. In Butte County, 29% of 7th graders, 32% of 9th graders, and 33% of 11th graders report feeling so sad and hopeless almost every day that they stopped doing some usual activities. That's why these last 3 questions are so important. Number 1, tell me, in general, how you think things have been going for you lately. Number 2, many of my other patients your age often talk about stress. What are the things that are most stressful for you these days? How do you manage stress? And number 3, what changes, if any, have you noticed in your sleep lately? Our number 1 goal is to identify issues early in a non-threatening manner. These questions are easy to understand and relate to. They normalize the conversation about mental health issues, reducing stigma and increasing opportunity for support. The referral process. We realize that you do not have sufficient time to adequately explore the details of each issue. Therefore, if you determine that a young person needs follow-up with substance use or mental health support, it is our goal to ensure that you can make a fast and efficient referral to the physician-committed intervention specialists. Simply document the nature of the referral and contact our team through phone or email. We will make contact with the young person within 1 week. They will have the opportunity to participate in up to 3 brief intervention sessions, integrating motivational interviewing and cognitive behavioral therapy techniques in hopes of reducing some of the negative behaviors and increasing positive behaviors. If longer-term support is needed, the intervention specialist will act as a navigator, helping that young person get connected to the support needed. We look forward to the opportunity to partner with you on this initiative. It is our hope that every medical touchpoint a young person has in our community will be an opportunity to keep any young person from falling through the cracks. Thank you for being a physician committed.